Good morning, students. Today's class is on the laboratory diagnosis of tumors. The learning outcomes of this lecture are listed here. As you know, one of the most important requirements for diagnosis of a neoplasm includes clinical data. So there are laboratory requisition forms which needs to be completely filled up to get a correct diagnosis. In any hospital, the three common investigations used for diagnosis of a tumor includes FNAC, pap smears, and biopsy. The specimen sent to the laboratory must be adequate, representative, and properly fixed. The gold standard investigation for diagnosis of a neoplasm is biopsy. Biopsy specimens taken are usually sent to the laboratory in 10% formalin solution. If it is for electron microscopy, it has to be fixed in glutaraldehyde solution. Nowadays, for a diagnosis, we employ a rapid technique which is known as frozen section. Here, we don't require any preservative. Fine needle aspiration cytology or FNAC is the first line investigation for the diagnosis of a neoplasm. It's a very simple technique, reliable technique, which can be used for superficial swellings as well as for deep-seated neoplasms. It is commonly employed in breast, thyroid, and lymph node lesions. You can see the instruments which are used for doing an FNAC procedure. We require a 22 G needle, a 10 cc syringe, and a pistol. Without giving anesthesia, we are introducing the needle into the lesion and aspirating the cells. Lights are made. 2 of them are air-dried and 2 of them are fixed in alcohol. Air-dried smears are used to see the cytology, and pap smears are used to find out the nuclear details of the tumor. Deep-seated organs like deep-seated lymph nodes, FNACs from lung, liver, and brain also can be performed. The important advantages are it's extremely reliable, it is rapid, and it does not require anesthesia. Another investigation done in the hospital for screening cervix is the pap smears. Pap smears are used for detecting infections, dysplasias, and neoplasms of cervix. 2 smears are taken, one from the ectocervix and one from the endocervix. This picture shows a pap smear where you can see the squamous cells, endocervical cells, and background of inflammatory cells. This is an inflammatory smear. So as I have told, the 3 common investigations used for diagnosis of neoplasm include pap smears, FNACs, and biopsies. But if you make a diagnosis by biopsy, it has to be confirmed by immunohistochemistry before we give the treatment to the patient. Immunohistochemistry is a technique whereby antibodies are used to detect antigens present in tumor. The 3 important uses of immunohistochemistry include categorization of undifferentiated malignant tumors, to identify the site of origin of metastatic tumors, and for detection of molecules having prognostic and therapeutic significance. Coming to the first use, that is for categorization of undifferentiated malignant tumors, we use 5 immunohistochemical markers, which includes LCA, S100, CK, desmin, and vimentin. If desmin and vimentin are positive, it indicates a sarcoma. CK positivity indicates a carcinoma. LCA positivity indicates a lymphoma. Another important use is to identify the site of origin of metastasis. Many tumors spread by hematogenous route to others. An example is follicular carcinoma of thyroid, which metastases to the bone. So if a biopsy is performed from the bone and immunohistochemical marker thyroglobulin is applied. If it is positive, it indicates that the tumor is from thyroid. That is, a follicular carcinoma of thyroid has metastasized to the bone. Third important use is for detection of molecules of therapeutic and prognostic significance. Examples include ER, PR, and HER2, which are employed in breast cancers. And ER and PR positive tumors carry a good prognosis when compared to an HER2 positive tumor. You are seeing the slide of immunohistochemistry, which is showing ER positivity. Another technique used for diagnosis of tumor is flow cytometry. Flow cytometry is employed to detect membrane antigens and the DNA content of tumor cells. It is widely employed for identification and classification of tumors which arise from lymphocytes and phagocytic cells. Molecular techniques are used for diagnosis of cancers. An important molecular technique employed is PCR. The uses are for diagnosis of malignant neoplasms, for detecting the prognosis of malignant neoplasms, and for detection of minimal residual disease. PCR is employed for diagnosis of leukemias and lymphomas. Amplification of N-MYC and C-MYC genes are used for identification and prognosis, assessing the prognosis of treatment with cancers. An example is amplifications of HER2 carries a bad prognosis in breast. Minimal residual disease, which is present after treatment, can be detected by molecular techniques. Diagnosis of hereditary predisposition to cancer can also be made by employing molecular techniques. For example, presence of BCRA1 and BCRA2 mutations are seen in breast cancers. Tumor markers are other investigation used for identification of tumor. Tumor markers are biomarkers which are found in the blood, urine, or body tissues, which will be elevated in conditions of cancer. The various tumor markers used are classified into hormones, oncofetal antigens, isoenzymes, mucins and glycoproteins, specific proteins, and new molecular markers. The important hormones used are HCG, calcitonin, and catecholamines. HCG is widely used for diagnosis of trophoblastic tumors, including choriocarcinomas, and non-seminomatous germ cell tumors of testes. Calcitonin is employed for diagnosis of medullary carcinomas of thyroid. Catecholamines are used in the diagnosis of pheochromocytomas of adrenal. An example of an oncofetal antigen is alpha-fetoprotein, used to detect liver cancers and non-seminomatous germ cell tumors of testis. An important isoenzyme used is prostatic acid phosphatase, used for detection of prostate cancer. Mucins and glycoproteins include CA125, CA15-3, and CA19-9. CA125 is used for identification of ovarian tumors, CA15 for breast tumors, and CA19-9 for pancreatic and colon tumors. Immunoglobulins are used for diagnosis of multiple myeloma. New molecular markers include p53 APC RAS mutations in serum for colon cancers, p53 RAS mutations in serum and sputum for pancreatic cancers, p53 RAS mutations in serum and sputum for lung cancers, and p53 mutations detected in urine for bladder cancers. These are the references. Thank you very much.